Good morning. It is good to be with all of you today. So I'm going to start out by sharing just a few numbers of our COVID patients that we have in our system. As of this morning, there are 6 patients. 4 of them are at Eastern Maine Medical Center, 1 at Mercy Hospital, and 1 at our A.R. Gould facility. Since the beginning of the pandemic, Northern Light has remained committed and focused on ensuring our ability to fulfill our mission and serve our communities. As the pandemic has evolved, we have monitored emerging information, followed data and guidance from leading authorities to inform our policies and procedures to keep our patients and our employees safe. The COVID-19 vaccine is the most powerful tool we currently have that significantly reduces the impact of the harm of COVID-19 to our patients, healthcare teams, and our communities. Data clearly demonstrates the vaccine reduces severity of illness and hospitalizations related to the infection. In fact, recent cases of COVID and related hospitalizations that we are seeing across the country are being seen primarily among the non-vaccinated population. The Delta variant is surging across the country, and we are seeing numerous states that are now being added to the high-risk category, and we are certainly not immune to this in Maine. We have remained steadfast throughout the pandemic in doing everything we can for the safety of our communities, our patients, and our employees. And we are now making changes to our approach to employee vaccination as noted in the press release you received. And at this time, I will turn it over to my colleague, Paul Bolin, to give you more details about our new policy. Paul?
Thanks, Dr. Marwaha. Like many hospitals and healthcare systems throughout the nation, Northern Light Health will soon require vaccinations of all staff once emergency use authorization for the COVID-19 vaccines currently in use is lifted by the Food and Drug Administration. This includes all employees in all locations, and we know that we would expect employees to start their vaccine regimen, if not already done, to start that within 2 weeks of the FDA removing the emergency use authorization. We put a lot of thought into this decision, and we are sure that it's the right choice for our patients, our staff, and our communities. We're very fortunate at Northern Light Health to have about 80% of our staff already vaccinated. So the staff right now are about 4/5 vaccinated, and the remaining group of 20% or so will be vaccinated during this coming period. And we think that's a very important component of our staff resiliency, our availability to provide care in a safe fashion and a safe work environment for our employees in all work settings. So we're very pleased with that. In addition, I want to note that we've provided about 250,000 doses of vaccine since the start of the pandemic, and vaccine continues to be readily available in our communities, in our Northern Light facilities, and in facilities throughout the state. So I would encourage anyone who is not vaccinated and is able to receive the vaccine to do so. Thank you.
Thanks, Paul. Now it's time to take questions for Paul and Dr. Marwaha. As I mentioned, I'll call on each of you and unmute your mic and have a chance to ask 2 questions. It's helpful if you can direct your questions to either Dr. Marwaha or Paul, but if you're unsure who is best to answer it, they'll jump in and make sure to get you the answers. So to kick things off today, we'll start with WVII, and I believe we have Blake with us today. All right, Blake, you should be able to unmute.
Hi, it's actually Stephanie. Blake gave me the link today. Good morning, everyone. Thank you so much. I guess my first question is going to be, we heard that Millinocket Regional Hospital was requiring their employees to get vaccinated. Was this something that you guys recognized and said, maybe we should go the same route? Or and when did this conversation kind of start, and you wanted to tell your fellow workers that this is something you want to do?
Sure, I can take that first stab at it. We've been reviewing and monitoring the situation closely throughout the pandemic. So the decision to require vaccination of our employees has been one that's been made over many weeks. We continue to look at the effectiveness and safety of the vaccine, and over time, that more information is becoming clear as hundreds of millions of people worldwide are vaccinated, and we're seeing the positive impacts of vaccine. So this decision is one that didn't happen in an isolated time. Certainly, we know that as the FDA reviews the Pfizer vaccine, likely first on their agenda, and considers removing the emergency use authorization, that's the time at which we've identified as our employees need to be vaccinated with one of the 3 vaccines that are available, both Pfizer and Moderna, as well as the Johnson & Johnson vaccine, all 3 of which we've been providing to patients and staff throughout the pandemic, are perfectly acceptable vaccine alternatives. But each of our staff needs to be vaccinated with one of those 3, with those few religious and medical exemptions noted as well.
Can you tell me a little bit about the religious exemptions that you just mentioned?
Sure. So we know that we're required to offer religious exemptions as an option for those who have a bona fide religious reason not to be vaccinated. We know that that number would be very small, and those who are exempted would be required to be tested for COVID twice each week to make sure that they continue not to be infected with COVID and therefore pose a risk to themselves. All right, Stephanie, I apologize. When did the sound break out? Did I answer your question, or were you not able to hear my response?
I think, Paul, that we caught the first bit of it, but if you want to start that part over, it might be helpful just to make sure that everyone got it.
And could you just tell me the question again? I want to make sure I'm...
Oh, yes. Great, I can unmute. So yeah, just to clarify, what are those religious exemptions and what qualifies as a religious exemption?
So we need to look on a case-by-case basis if someone has a bona fide religious exemption, or they would certainly request it and we would review it. But we need to understand what the religious parameters are of why they believe that there is a religious need not to be vaccinated. We think that number is going to be very, very small. We've seen other healthcare systems and hospitals throughout the country offering similar religious exemptions, and those numbers are, again, very small. Those who do have an exemption, both medical or religious, would be required to be tested for COVID twice per week throughout the pandemic until the CDC declares the pandemic to be over.
Thank you, Stephanie, for your questions. Next up we have Phil, WMTW. Phil, you should be able to unmute.
All right, can you hear me?
Yes, we can.
Great, good morning.
Good morning.
First question is for Mr. Boland, sort of picking up where you just left off. For those that, the 20% of people who work for you who have thus far refused to get vaccinated, for those that do not have a legitimate religious exemption or some kind of immunization issue as well, will they be terminated? And secondly, Mr. Boland, do you have any intel as to when the FDA might actually shift from emergency to regular authorization?
So let me start with your second question first. So we've heard from Dr. Shah and others that the FDA is really on their own timetable, although they have committed to accelerating their review process. My speculation would be as good as anyone that the fall is the time frame, so that could be September through December. We are expecting it sooner than earlier fall than late fall, but again, we're looking at 6 to 8 weeks probably in that time frame. With regard to employees who choose not to be vaccinated and are not provided or approved with an exemption, they would be removed from the schedule and not permitted to work. We would hope that they would reconsider that approach. We think that will be a very small number. We've heard from employees anecdotally through our rounding and informational sessions that some of those who have been hesitant to receive the vaccine have cited the emergency use authorization as one of the reasons that they have not been vaccinated. So we're very hopeful that once the FDA has full approval of the vaccine, that some who were hesitant will have their concerns resolved and then become vaccinated. So I think the numbers of employees who ultimately will not be vaccinated and not be exempted will be a very, very small number. But we have heard from employees also who are very thankful, and patients and community members who are very thankful and have been encouraging us to take this approach to make the workplace and the care setting even safer. And so we're very optimistic that this is the right move for Northern Light Health, for our patients, and for our communities.
Before I ask my question to Dr. Marwaha, just to be clear, when you say removed from schedule, does that mean suspended or terminated?
Removing someone from the schedule means they're not permitted to work. And if they have paid time off, they would certainly be able to take that. And that would be, they would be not permitted to work until such time as they become vaccinated.
Thank you for clarifying that. Doctor, for you, the position that Northern Light Health is taking obviously speaks for itself, and you and Mr. Boland have explained your rationale. But I wanted to ask you, do you think that all hospital and healthcare workers, in addition, all emergency responders like firemen and policemen and ambulance techs, and for that matter, teachers, these are the three groups that have been lumped together from the beginning, were put to the front of the line by our politicians to get vaccines, yet to some of us, it's a surprise that there's not a higher level of compliance. You, of course, have said you have 80%, which is above the state average. Some of these other groups of professions, which have the most public-facing jobs, with the most children, with the most adults, have lower than the average. Do you think as a medical policy, all healthcare workers, emergency responders, and even teachers should also be entering into this mandate mode that Northern Light is entering?
That's a great question, and I think it's a complicated one also. You know, we go into this, I'll speak for healthcare, I'll speak for myself, went into this profession because of a desire to take care of others and to, you know, treat other people and keep them safe and healthy. And, you know, it may not be the right fit for everyone. The decisions that people make for not getting vaccinated, we have to respect them. I think everyone has multiple reasons, so it's not a straightforward question of you know, sort of black and white issue. But I think it really comes down to responsibility and obligation to the profession that we've committed our careers to, and it's a bigger question, I think, for policymakers, but will require a good amount of healthy debate and conversation to come to a mutual agreement. But I think it's, you know, I approach it as an individual responsibility. I have a responsibility to the profession I chose and to the people I come into contact with, and they may be patients and they may be my colleagues when I'm in a non-clinical setting. So it's a complicated question which will require a lot of healthy debate.
Thanks, Phil, for your question. Next up we have Erwin Gratz, Maine Public. Go ahead, Erwin.
Good morning. Two questions for Dr. Marwaha. Sorry.
That's okay.
First of all, do you have, among the half a dozen patients in your system, are any of those at the moment breakout cases? And if they are, how seriously ill have they become?
Could you clarify what you mean by breakout cases?
People who've been vaccinated.
Okay, so I currently don't have that information if the patients in our system right now with COVID-19 infection have been vaccinated, but we can certainly look that up and get back to you.
Okay, and the other question is kind of about, you know, patients obviously brought into your system for all sorts of reasons at the moment. What are you doing with them? Are you checking them for vaccination status? And does that then determine perhaps whether or not you test them for COVID? How is that working?
We currently are staying with the policy that we put into place at the beginning of the pandemic for testing all patients that are admitted to our hospitals for the COVID infection. So we do ask our patients if they've been vaccinated, and this is more to encourage the folks that haven't chosen to make this decision yet. But we are sort of doing the dual approach, screening and asking about the COVID vaccine, offering the vaccination to them, but also especially for the protection of all the vulnerable patients that are in our facilities, we continue to test everyone that is admitted to our facility.
All right, thanks everyone for your questions. Next up we have Corey Bushard, WAGM.
Thank you. I'm not really sure who to direct this to, so I guess I'll just ask it, and best person to answer it. What is the current percent of employees that you have that are vaccinated?
Yep.
So this is Paul, I can take that. So the last, we refresh our data about every 2 weeks. 79.2% was the data that was effective July 20th, and we've been vaccinating people since then, and we'll have a refresh on that by the end of this week. So it's more than 79.2, and probably around 80% would be the closest number that I could give right now. They do vary by specialty. For example, our physicians and our nurses are vaccinated at a higher rate than that. And so we're able to target some of our communication with staff to make sure we're available and answering questions to those groups who have a lower level of vaccination.
Okay. And my second question is, obviously you're making this a condition of employment to be vaccinated. So if FDA mandate does go into effect and you hire a new employee, that new employee hasn't been vaccinated yet, will you either deny their employment, or what would the timetable be for a new employee who's not vaccinated to get vaccinated?
Sure. So if you're talking about once the emergency use is lifted, yes. Going forward from that point, just as we have with a number of vaccinations and immunizations for many, many years in healthcare have required certain vaccines and immunizations to be in place for a person to start employment in a healthcare setting, COVID will be added to that long list of appropriate vaccines that we would require for people to start. So once the emergency use is lifted and full use authorization is given by the FDA, anyone who would be starting in healthcare would be required to be vaccinated for COVID from that moment. We have a pre-hire physical that would happen, and checking vaccination records and providing the vaccine at that time would be what we would do in those cases.
All right, thanks Corey for your questions. Next is Leslie Landergan, pronounced that big press. Go ahead, Leslie.
Hi, you've answered all my questions, thanks.
Great.
You're welcome.
Easy enough. All right. Next, WABI, Allegra. Hold on just a sec, Allegra. Okay, you should be good to go.
Last question, say that the emergency approval goes through, the FDA approves the vaccine, and those 20% say, no, we're not getting the vaccine. Is there any fear about hiring efforts being fully staffed or short-staffed moving forward if people deny getting this vaccine?
Sure. I think that there's always a concern. And in healthcare, we have to have staff in order to provide care. But we also know that having staff who are able to work and avoid being ill, or to avoid being as seriously ill as some of those who might, the small percentage that would have a breakout illness. What we saw during the early months of COVID is we had just under 500 of our employees out quarantining. And that number is down now to a tenth of that, so less than 50 people out. What we want to make sure is that we have a workforce that's here to provide care to our patients and our communities, and vaccine is a critical piece to that workforce continuity that we need to have in place in order to have that surge capacity. We're seeing in other parts of the world and other parts of the country how this pandemic is resurging with the Delta variant. We need to be prepared for that here, and vaccine is the best way we can do that.
Great, thank you.
Thank you.
Okay, next we have David Marino, Bangor Daily News. David.
Marwaha. Why wait until the vaccine gets general authorization from the FDA? Northern Light has spent many, many months kind of talking about the safety of the vaccine and saying that despite the emergency use authorization, that it's safe and it's been tested. So my question is, why wait until the FDA generally approves it rather than just the emergency authorization?
So I can start with that, and Dr. Marwaha can provide a clinical view. We do think the FDA's approval process is an important one. We know that the vaccine is safe because hundreds of millions of people have had it, and we've seen the improvement in health in large populations as a result of being vaccinated compared to being unvaccinated and thus susceptible to COVID illness and death. So we know that that's the case. We do think that it is appropriate for us and our organization to wait until the FDA removes its emergency use authorization, but that's not the choice that others are making, and we respect that, and other organizations. Right now, this is something that we've thought a lot about, and it's the right move for us. We've heard from our staff and from others that are holding that FDA approval as a high bar, and so we're using that to help determine when the vaccine will be mandated. But our focus for many weeks and months up to this point has been to vaccinate the 80% who are currently vaccinated, and that's required significant effort to provide the vaccine and education and the like. So I think the timing, if you look at now and look forward to when we expect the emergency use to be lifted, organizations that are waiting for emergency use and those that are not are all going to be ultimately vaccinating people as a requirement around the same time frame. So it's because of the nature of the vaccine, in which you receive one dose, unless you're getting the J&J, you're getting one dose, and waiting 2 weeks, getting a second dose, and then 2 weeks following that to be considered fully vaccinated. That lag time is all very similar to the entities that are waiting for the emergency use to be lifted. But for us, it was the right decision.
Yeah, so I'll just, Paul said it really well. I think that we have sufficient evidence, just if we look at the numbers of millions of people who've been vaccinated, what are the risks and the side effects. It's a very, very small percentage. It's generally safe. So, we have good data. We also wanted to be respectful of those of our employees who are saying, I want this to be formally approved, and we have to respect their views and opinions. So I think this is, again, as Paul had said earlier, was not a decision that we just made this week. We've been monitoring the trends, seeing the other healthcare systems that were sort of moving this way, looking at more information coming out around vaccine efficacy and protection, and we just feel that the FDA removing the EUA is the right time to sort of get those folks on board who are just waiting for this to be formally approved.
Great, thank you. And my second question is, there was some data released by the Maine CDC, I believe as of June 30th, showing the different breakdowns of Northern Lights hospitals. And I noticed that some of the more rural hospitals, such as Sebasticook, Northern Light Mayo, they have some of the lowest rates, 65, 64, whereas the Portland, Blue Hill, Prescott, they have some of the higher ones. Is there any fears about trying to get vaccination, those more rural places vaccinated, given that the hesitancy is higher? And are you planning any strategies to try to encourage employees to specifically get vaccinated in those areas? And I think Paul might be the best person to ask this of.
Sure, thanks. We really have been focusing on the various strategies to ensure that we're answering questions about hesitancy. And we know in some of our communities, and likewise the hospitals that we have operating in those communities, have a lower vaccination rate than others. And so we're trying to target our communication to address the issues as people bring them up. But I think similarly, as we see statewide, those populations and those communities, that education does provide the basis for better informed decisions and for higher levels of vaccination. But we know that there's work to do, and in those hospitals that have a lower rate than our system average, we want to focus to make sure that we're being respectful and caring for those employees and providing the information and fact-based data for them to make their decision. And we think ultimately with this decision and this policy change that we made and announced yesterday, that over the next several weeks those employees in large part will become vaccinated get their questions answered along the way, and be able to continue with us. That's certainly our intent and our hope.
So I'll just add to that. I mean, I think you asked the question, what are the different strategies? We're using every strategy that we can think of. And I think Paul really honed in on, it's the education piece. It's really important to understand why folks are hesitant. And so, we heard concerns from women who were worried about impact on reproductive health. And so we've had our clinical leaders in those specialty areas do, sort of town hall type sessions, or reaching out or providing a forum where those specific questions can be asked. So our strategy really is to try to understand the reasons for vaccine hesitancy, and there isn't one, and making sure that we are providing the best information so that patients, employees, communities, everybody is making the right decision, are making a well-informed decision, and not a decision that is based on anecdotal evidence or some misinformation or misbeliefs about this vaccine.
Great. David, thank you for your questions. Last but certainly not least today, we have Chris, News Center Maine. Chris, you should be able to unmute now. News Center Maine.
Oh, there we go. Now it's allowing me to unmute. Sorry about that. If you don't mind, I'd like to ask a quick clarifying question before I get to my other questions. And it can be either for Mr. Bolin or Dr. Marwaha. Dr. Marwaha, it's good to see you again. The quick clarifying question is this, and this has to do with kind of the vaccination process for your employees. We had talked about a couple of things. We talked about when the employees would be required to be vaccinated by. You guys had said it would start within 2 weeks of the full authorization. There was also a question about new hires and when they would be required to be vaccinated. And I just wanted to clarify. Are we talking about starting the vaccine process, or are we talking about fully vaccinated within the 2 weeks that the full authorization goes into effect? And I guess as it relates to the new hires, do they have to be fully vaccinated before they begin working?
So we would be, from a vaccination point of view, when emergency use is removed and the FDA gives full approval, we will require within 2 weeks of that date that employees who are not yet vaccinated and not exempt will be required to get their first dose. And so if that's Johnson & Johnson, they would be considered fully vaccinated 14 days after that first dose. For Pfizer and Moderna, they would have that 2 week window to get their vaccine and get their first dose, and then a 2 week waiting period before their second dose, and then following that 2 weeks, which is essentially 6 weeks from the date of the emergency use being lifted, they would be considered fully vaccinated. For new hires, we would expect them to receive the vaccine no late going forward. Once the emergency use is lifted, our new hires hired after that time would expect to either be vaccinated fully before they start, or to receive their first dose in their new hire physical, and then follow their second dose, and during that time period would be required to test twice per week during that period where they've developed their own immunity.
Okay, thank you for clarifying.
Sure.
I just wanted to ask, just because I think we spoke about it a little bit in some generalities, so I just wanted to be a little bit more specific. If one manufacturer vaccine gets full FDA authorization first, has there been any consideration to either employees who would prefer to take a different vaccine and say that they'll take, for example, if Johnson & Johnson gets the full approval first, but somebody would rather take Moderna or Pfizer? Has that kind of been discussed, and what's the I guess the plan around that? I'm sorry for lack of a better.
Sure. So at Northern Light, we've been supplying and providing a vaccine for Moderna, Pfizer, and Johnson & Johnson for months now. All of those three vaccines we consider acceptable vaccines, and if an employee has received one or the other, we are ambivalent and see them as fully vaccinated once they've completed their vaccine series. And so once the emergency use authorization is lifted and we mandate vaccines, that any of the vaccines that employees choose to receive, any of those three, we would consider them to be fully vaccinated and compliant.
Oh, okay. I guess what I was saying was, you know, if one manufacturer should be given that full authorization first, and an employee has not yet been vaccinated, and then, you know, so for example, if it's Pfizer,
Right.
Would you require all unvaccinated employees to then get Pfizer, or will you allow some to wait until other brands, so to speak, have been given that full authorization? What's the process?
We would accept any of the 3 vaccine types, but we're not delaying the deadline. And so once one is approved, then any of the 3 are acceptable, and employees can choose among the 3, whatever is available to them. But we would not be delaying for the other 2 to receive emergency use authorization to be lifted.
Okay, thank you.
You're welcome.
And then you had mentioned during the part about religious exemptions and so on and so forth, that there would be and I think that's kind of where we lost the audio, was that there would be a required regular testing of COVID. I was wondering if you could, 1, just repeat that, and then 2, you know, in the meantime, for your unvaccinated employees, are they being required to be tested, or any quarantine or isolating procedures until we receive the full authorization of one of the vaccines?
Sure. So we continue to follow the CDC guidelines, and with masking and other hygiene approaches in terms of hand washing and distancing and the like in our clinical care setting. So that will continue ongoing until or unless the CDC changes those recommendations. We do know that as employees are requesting in small numbers exemptions for medical or religious reasons, those employees who are approved to be exempt will be required to test for COVID twice per week on an ongoing basis until the CDC determines that the pandemic has ended. So that would be going on into the foreseeable future. Did that answer your question?
It did.
Okay.
The last question for Dr. Marwaha, I think, is what's the most common piece of misinformation you hear from your unvaccinated employees about the COVID-19 vaccine?
Oh my, there's so many out there. I think there's it's from the rational to the irrational, right? I think the most rational ones that, you know, women, like I mentioned before, are sort of concerned about is there an impact on reproductive health? And, you know, totally valid question, and that needs to be answered. And all the data we have so far suggests that no, this vaccine and these vaccines are as safe for women of childbearing age than for the rest of the population. There have been some, you know, weird ones out there. I was just reading an article yesterday about the different approaches they're taking in Arizona to try and get people convinced, and this one just actually kind of stopped me dead in my tracks, which, you know, patients, somebody said, well, this vaccine is going to make us magnetic. I don't know how you answer that question. You know, then there's the other ones where people think it's changing their DNA because it's an mRNA vaccine. So, you know, I think you get the whole broad spectrum, but it is, I think we have to remain respectful and curious and try to understand why those beliefs are formed, why people are choosing to believe certain things, and then help address those in a supportive manner that gives them the facts and educates them and gives them the information to make the right decisions.
Okay, well, it looks like we've gotten to everybody today, so we'll wrap things up. Thanks to everyone for attending today. As we said earlier, we do have the high-quality video file available. It's usually available about 2 hours after the briefing. If that's something that you'd like and you haven't let us know already, let us know in the chat or send us an email and we'll get that over to you this afternoon. Thanks again for joining us. Thank you, Paul. Thank you, Dr. Marwaha.
It's a pleasure. Thank you.
Have a great rest of your day.
Thank you.